Thank you so much for this opportunity to present our experience performing the Z-palm as well as measuring the upper esophageal sphincter morphology. These are our disclosures. Z-palm is a flexible endoscopic technique that adopts the technique of mucosal tunneling from the palm procedure to perform cricopharyngeal myotomy. It allows for a complete myotomy under direct visualization and it's not restrained by hyperextension of the neck, which is one of the restraints of rigid endoscopic procedures. The aims of our study are to describe our experience in performing the Z-palm procedure, as well as to report our impedance planimetry results before and after myotomy. This is a single institution retrospective review of a prospectively kept database. All patients from 2014 to 2022 who underwent Z-palm were included. Our primary outcome was clinical success, which we defined as a greater than 85% resolution of dysphagia. Secondary outcomes were adverse events, quality of life, as well as change in distensibility. 54 patients were included in the study with a mean age of 72. Average OR time was 35 minutes, and the median diverticulum size was 2.5 centimeters. We were able to complete Z-palm in all of our patients without any cases of intraoperative abandonment. There are also no intraoperative complications in our series. 30-day mortality rate was 0%, and 85% of patients reported complete symptom resolution at 1 month. There are 3 perioperative adverse events, all of which were contained leaks. These are all done early in our experience, and no additional intervention was required for resolution of these issues. There are 3 readmissions, 1 for dysphagia, 1 for a contained leak, and 1 for aspiration pneumonia. Regarding repeat endoscopic interventions, 3 patients actually had recurrent dysphagia requiring repeat intervention. 1 had a repeat myotomy, 2 had subsequent diverticulopepsies, and we know that these patients all had large diverticulum, which we define as greater than 4 centimeters. Regarding quality of life, we looked at the reflux severity index as well as the GERD HRQL scores as representative of dysphagia. From 3 weeks to 5 years, a statistically significant improvement. However, they did not hold true for our dysphagia score, which is a 1 to 5 score. Regarding impedance planimetry, we did show an objective improvement in minimum diameter, cross-sectional area, as well as its distensibility index. And this is just an example of the morphologic change we see before and after performing Z-palm. Z-palm is a safe and effective procedure. Impedance planimetry may be useful to determine adequateness of myotomy. However, we still don't know what the change or final DI or cross-sectional area should be, and large diverticula may be best treated with subsequent diverticulopexy. Thank you.